So begin on the back with the knees bent and the bottoms of the feet on the floor. And feel free to adjust your position as needed. You can move your hips. You can make the legs wider or closer together. You can draw the knees in or out. Move the shoulders. And you can even bring your hands behind the back of the head and gently pull the back of the neck out. And then place the head back on the ground, resting in a comfortable and supported position. And then take a breath in through the nose and exhale through the mouth, and you can make a sound and feel the muscles of the body release. So this is an important first step in this practice, is to allow for the nervous system to release some of its grip on the body. And we'll bring one hand onto the chest, one hand onto the lower abdomen, and for a few moments feeling the body breathing here. And as the breath is moving the body, see if you can keep the body as soft and pliable as possible, just allowing your breath to move it, allowing your body to do what it needs to do. And on your next exhale, exhale into the chest area and tone these muscles of the chest so that the chest gently draws down, and then relax the muscles of the lower abdomen. And focus on taking about 5 breaths here, softly breathing into the lower belly. And then relax the upper chest area. And on your next inhalation, breathe from the lower abdomen and gently draw the breath up to the upper hand, the chest and rib cage area. It's nice and soft with the lower abdomen. Breathing into the upper chest, and then on your exhale, gently breathe down from the upper chest, softly moving the breath out through the lower abdomen. And we'll take a few more breaths like this. And as you're inhaling, see if you can gently draw the breath into the back body as well as the front body. So typically it's a little bit easier to breathe into the front of the body. Try to gently draw the breath back against this floor. And as you're inhaling, see if you can breathe outward, expanding your breath out from the center of the body to the side body, the outer ribs, underneath the armpits. And a few more breaths like this. See if you can simply feel your breath expansive in all directions. So breathing up and down evenly, breathing forward and back, breathing in and out, away from the midline. And then from this position, bring your hands by your hips. You can keep both knees bent or straighten the left leg. And this whole practice is experimental. See what works for you. We're going to bend the right knee into the body, And you can use your hands or choose not to use your hands. And from here, we're gonna move the leg to the opposite shoulder. And then return back and straighten the leg slowly. We'll do this 4 more times. So bend the knee and move it to the opposite shoulder and straighten the leg. Again, bend the knee. Move it to the opposite shoulder. Come back to the center. 2 more times. And again, experiment with using your arms to do this. And everyone will be a little bit different. So go with what feels good to you. And then we'll switch legs. So left knee is bent. Bringing the leg in. And then to the opposite shoulder. And then straighten the leg. We'll do this 4 more times. In, towards the opposite shoulder. And then straighten the leg. Again, bring the leg in, towards the opposite shoulder. And then release. And 1 more time, bring the leg in. And towards the opposite shoulder. And back. And then both knees will bend really gentle here. Small circles. So as small as you can, circle your knees. And then reverse directions. And the goal again is to keep the body as relaxed and pliable as possible. So we don't want to turn on our nervous system stress response while we're doing these exercises. And so from here, we'll roll over to the side, getting up gently in any way that you need to. And we're going to move into a 90-90 position where we have one knee over the heel, other hip is over the back knee. And from here, we're going to keep the spine tall and neutral. We'll come forward and back. And again, keeping the spine tall and neutral, forward and back. So only go to as far as you can go without becoming either tense or feeling your spine having to arch here. So we'll do 1 more. And then find some place in between, and you're going to circle your knee here 5 times. And reverse. Good. And then coming back to this neutral position, we're going to come onto the heel. And here, I'm going to bring my right shoulder towards the big toe and then come back. So you can use your hands like this. So bring the hand down, bring the shoulder to the big toe and come back. Left hand on the hip. Nice and relaxed. And from here we'll hold for about 5 breaths. Now come back to your breathing, breathing into the back body, keeping the body very soft and relaxed. Good. And then we'll come back up. We're going to do the other side. So 90-90 position to begin with. Knee is over the heel, hip is over the knee. I'm going to come forward with a nice tall spine, remaining neutral here, and then come back, forward, and back, forward, and back, forward, and back. 1 more time, forward, and then back about halfway, and then from here, we're going to circle our knee a little bit and then reverse. Good. And then return to our 90-90. We'll bring the other heel down. So right hand stays on the hip, I'm gonna bring the left hand down and the left shoulder towards the big toe and come back. Left hand down, shoulder towards the big toe and come back. So slow and controlled is the name of the game here. As you're doing this, think about pulling your little toe back towards the hip, pushing through the big toe mound. We'll hold here for about 5 breaths. It's nice and soft and relaxed. Good. And from here, we'll do 5 really slow, gentle cat-cows. So again, as we're doing this practice, it's experimental. So we're moving in and out of things and looking for information as we do this. And as well, we are looking to keep our nervous system as relaxed as possible. So when I feel my sciatic nerve pinch, I feel an abrupt taking over of my nervous system that sort of seizes my body. So we certainly don't want to aggravate that by moving into something that again causes the body again to seize in that way. One more on our back here. We're gonna come into a 90-90 position so you can adjust as you need. And from here, we're going to bring the leg in and out as much as possible. Try to keep the other leg relatively still. So we're isolating. In this case, I'm on the right hip. It's okay if you're on the left. And then finally, I'm going to gently push my right shin against the left leg and resist with my leg for 2 more breaths. So add a little bit of work to this if this is okay, if the muscles don't feel like they're overly tense or the nervous system is beginning to tense. And then make this more passive. If you have the range of motion, you can bring the leg in a little bit more. If you have even more range of motion, you can wrap your arm around the leg like so. But again, find the honest point where you feel a stretch or release without the nervous system feeling like it needs to take over. I'll do 1 more breath like this. And release here gently. And we'll do the other side. So I'm doing my left side now. So 10 repetitions, I'm gonna bring the knee towards me and then away from me here. Trying to keep the right leg still. So pulsing, there are little movements here. And then from there, resisting. So I'm pushing my outer left shin against the right leg and the right leg is resisting here. Good, and then relax. Again, bring your arms around the leg. If you have the range, you can bring the leg in closer. As you bring the leg in closer though, make sure that you don't lose the hip rotation, in other words, the knee coming towards the body, that we keep the shin parallel facing towards the right leg or the front leg. And again, if you want to take this cradling position, you can do that as well. 2 more breaths here, soft here. Good. And relax from here, lifting 1 more time with the knees moving in the smallest circles you can possibly move in. So really fine motor skills here. And then reverse. with our feet on the ground, coming into this resting position. One breath in through the nose, exhale, release through the mouth. You can adjust in any way, move your hips, move your shoulders. If you'd like, pull out your neck. And then rest here for as long as you need, with the goal again being that we're just allowing our system to release some of its control.